Hi, so I'm going to be talking about microaggressions and code of ethics. So key point one, what are microaggressions? Microaggressions are a statement, action, or incident regarded as an incident of indirect, subtle, or unintentional discrimination against a member of a marginalized group, such as racial or ethnic minority. For example, a teacher praising a black student for her great command of English, a woman constantly being interrupted while speaking in a meeting, and a person being told by their colleague, but they don't even look gay. I think it's important to mention that these microaggressions can be unintentional because we need to be aware as aspiring counselors that we are also capable of these microaggressions. We are, after all, human, but once we are able to acknowledge it, we are able to move forward with it and counsel our clients in the best way possible. So I'm going to start off with American Counseling Association Code of Ethics and a few codes that I believe relate to microaggressions and how we can move forward with them as counselors. Developmental and cultural sensitivity. Counselors communicate information in ways that are both developmental and culturally appropriate. Counselors use clear and understandable language when discussing issues related to informed consent. When clients have difficulty understanding language that counselors use, counselors provide necessary services, such as arranging for a qualified interpreter or translator, to ensure comprehension by clients. In collaboration with clients, counselors consider cultural implications of informed consent, procedures, and where possible, counselors adjust their practices accordingly. So they gave one example, such as providing an interpreter. I would like to give another one. So you wouldn't want to throw around or toss around big words if your client comes from a low educational background or low socioeconomic background. You would want to be more relatable to your client and also make sure that they understand the counseling that you are providing for them. So that is one way that you can be more inclusive. Second, diversity considerations. Counselors maintain awareness and sensitivity regarding cultural meanings of confidentiality and privacy. Counselors respect differing views towards disclosure of information. Counselors hold ongoing discussions with clients as how, when, and with whom information is shared. So it's just basically all about being aware. Within a medical setting, there are certain religions who are not allowed to get, blood transfusions, or just in everyday life. In certain religions, women are not allowed to touch men. So just having that awareness of different cultures to the best of your ability can help, your client when it comes to counseling. It also shows that you are trying to understand them as well. Cultural sensitivity. Counselors recognize that culture affects the manner in which clients' problems are defined and experienced. Clients' socioeconomic and cultural experiences are considered when diagnosing mental disorders. So we are going to talk about this a little bit more further on, but just to sum it up, these microaggressions, even though they seem slight and subtle, it can have a huge macro impact on people in their day-to-day lives. So as counselors, it's important for us to make note of that and also just be aware, especially since we are human and are also capable of these things. It's important for us to not take it lightly. Multicultural issues, diversity, and assessment. Counselors select and use with caution assessment techniques normed on populations other than that are of the client. Counselors recognize the effect of age, color, cultural, disability, ethnic group, gender, race, language preference, religion, spirituality, sexual orientation, and socioeconomic status on test administration and interpretation. And they place test results in proper perspective of other relevant factors. So basically, again, you would want to be able to explain to your client in a way that best fits them and a best way that they understand, so that way that they can make the best decisions for themselves as well when it comes to these tests and these diagnoses. I also want to note that with counselors selecting and using caution when it comes to certain techniques also shows that you are aware of your client and their background, and it kind of just goes back to that awareness that we were talking about earlier. American Association of Christian Counselors Code of Ethics. Let's get into it. Affirming human worth and dignity. Christian counselors recognize and uphold the inherent God-given worth and dignity of every human person, from the preborn to those on deathbed. Human beings are God's creation and consequently are all due the rights, respect, and order logic that this fact of creation entails. Therefore, Christian counselors express appropriate care towards any client, service, inquiring person, or anyone encountered in the course of practice or ministry without regard to race, ethnicity, gender, sexual behavior, or orientation, socioeconomic status, age, disability, marital status, education, occupation, or denomination, belief system, values, or political affiliation. God's love is unconditional, and at this level of concern, so must be the Christian counselor. I particularly like this because it first just starts off by saying we are human and we are worthy and we are worth dignity. So if you approach every client as so, you shouldn't have any problem with any of the code of ethics discussed before and after this one. Cultural sensitivity, once again, Christian counselors proactively communicate with clients in a culturally sensitive manner, especially when obtaining consent, defining the scope of care during assessment, and evaluation procedures, including instruments that are selected and addressing any developmental and or linguistic issues that may be present. So again, back to my example, you want to be able to describe and assess your client in a way that they understand. It just shows that they are worthy of the care that they're getting, and that way they're not confused, and they're capable of making decisions for themselves. Working with persons of different faiths, religion, and values, counselors work to understand the client's belief system, always maintain respect for the client, and strive to understand when faith and values issues are important to the client and foster values-informed client decision-making in counseling. Counselors share their own faith orientation only as a function of legitimate self-disclosure and when appropriate to the client's needs, always maintaining a posture of humility. Christian counselors do not withhold services to anyone of a different race, ethnic group, faith, religion, denomination, or value system. So you want to not lose yourself because your client is different. You don't want to lose your religious beliefs or your faith or your values. But you don't want to force or push them upon your client. You only provide them when it's necessary and the client is willing. At the end of the day, we are here to support our clients in the best way possible while also protecting ourselves. Employment diversity. Christian counseling educators ensure that their programs seek and attempt to retain students of faculty of a diverse background, including representation by women, minorities, and people with special needs. This will help your client be more comfortable in the environment that they are in. So even though you are not of the same background of that client, they understand that you try to make the efforts to understand their background when they see people that look like them. It just also makes them more comfortable in the environment and also provides them a sense of they matter and they are acknowledged here. Key point 2, understanding the harmful psychological impact of microaggressions on marginalized groups or failure of counselors who do not uphold the ACA or AACC Code of Ethics. Counselors need to understand that these everyday slights are not harmless, trivial, or insignificant. Microaggressions have powerful detrimental macro impact upon targeted individuals. A lifetime of microaggressions can lead to a sense of futility, hopelessness, anger, and distress. It's also important to note that these themes can foster to other disorders such as anxiety or binge drinking. So within this PowerPoint project presentation, we should be able to understand what microaggressions are, how they apply to the Code of Ethics, and how they impact our clients in a major way. You should also be able to understand the isms and how we can combat them individually and holistically. And thank you.
Topic 3, the evolution of the isms and microaggressions. Isms are the behavioral manifestation of bias, conscious or unconscious, that reinforce oppression and inequities in our culture. The evolution of the isms has brought about new forms of discrimination and microaggressions, while overt acts of racism, sexism, ableism, and homophobia, also known as heterosexism, are still prevalent. The subtle and covert nature of microaggressions has become more prominent throughout our society within the last 5 years. These microaggressions are often disguised as jokes, compliments, such as for a person of color, you're so articulate or you're so smart and well behaved and well mannered, or dismissive comments making them harder to identify and address. However, it is essential to understand that the impact of these microaggressions in the form of isms are just as damaging, if not more so, as they perpetuate systemic inequalities and hinder progress towards a truly inclusive society. The evolution of racism, sexism, heterosexism, ableism, and religious discrimination has given rise to covert microaggressions as they allow individuals to express their biases and prejudices in subtle ways. This covert nature not only allows the perpetrators to deny any wrongdoing, but also makes it difficult for the victims to speak out or seek support. It is crucial for our society to recognize and confront these microaggressions to create a safe and equal environment for all individuals, regardless of their race, gender, sexual orientation, ability, or religion. By addressing these covert acts, we can challenge the underlying system of oppression and work towards a more inclusive and just society. Racism is another example of discrimination that exists not only in overt forms, such as hate crimes or explicit racial slurs, but also in more subtle ways. These subtle acts of racism, often referred to as microaggressions, can include racial stereotypes such as angry women of color, unconscious bias such as people of color don't know how to swim, or systemic inequalities that disproportionately affect certain racial groups, such as people of color not being able to advance in their education and their professional lives. By understanding and confronting these racist behaviors, we can work towards creating a more inclusive and equal society that celebrates diversity and promotes racial justice. Some may argue that these subtle acts of racism are not harmful as overt forms and therefore do not require the same level of attention or action. However, microaggressions can still have a significant impact on individuals and contribute to a broader culture of racism and discrimination, perpetuating inequality and marginalization. For example, a detailed counterpoint to this notion that subtle acts of racism are not harmful could be the case of a minority student constantly being overlooked for leadership positions or opportunities in their school or workplace. Although it may seem subtle, this discrimination can have long-lasting effects on the individual's self-esteem and career prospects, perpetuating inequality and marginalization in our society. Additionally, dismissing these instances as inconsequential can further reinforce the notion that discriminatory behavior is acceptable, hindering progress towards a more inclusive society. Sexism is by definition the belief that one gender is superior to another and the discrimination or prejudice based on this belief. It is important to acknowledge that sexism exists not only in overt forms such as sexual harassment or unequal pay, but also in subtle ways. These subtle acts of sexism, often referred to as microaggressions, can include demeaning comments, stereotypes, and exclusionary behavior toward a particular gender, specifically females. By addressing and challenging these microaggressions, we can begin to dismantle the deeply integrated sexist ideologies that perpetuate inequality and create a society that values and respects all genders. However, it is important to note that not all acts of exclusionary behavior towards a particular gender are rooted in sexism. For instance, in certain cultural or religious contexts, there may be practices or traditions that appear exclusionary but are based on different beliefs and values rather than sexist ideologies. Therefore, as therapists and counselors, it is crucial to approach each situation with cultural sensitivity and understanding to avoid making assumptions about intent and perpetuating these stereotypes. Heterosexism is another form of discrimination that can manifest in both overt and subtle ways. Overt forms of heterosexism may include homophobic slurs or hate crimes against LGBTQ plus individuals, while subtle acts of heterosexism can be seen in the denial of same sex relationships or the invisibility of LGBTQ identities in mainstream media, such as pronouns he, she, they, them. By challenging heterosexism and promoting acceptance and equality for all sexual orientations, we can strive for a society that values respect, diversity in all its forms. Some may argue that heterosexism is not a form of discrimination, but rather a reflection of societal norms and traditions that prioritize heterosexual relationships and identities. However, this argument fails to consider the harmful consequences of heterosexism, such as the marginalization and stigmatization of LGBTQ plus individuals. A detailed counterexample would be the lack of legal recognition and rights for same-sex couples, which denies them the same benefits and protections that heterosexual couples enjoy. This unequal treatment clearly demonstrates how heterosexism perpetuates discrimination and inequality. In the Bible, it does say that God created man and female in a union for marriage. However, it is not our place as stewards of Christ to judge or condemn those who are of a different sexual orientation. Ableism is another form of discrimination that can manifest, again, in both overt and subtle ways. Overt forms of ableism may include physical barriers that prevent individuals with disabilities from accessing public spaces or discriminatory language and attitudes towards people with disabilities. Subtle acts of ableism can be seen in the lack of accommodation and support for individuals with disabilities or the underrepresentation of disabled individuals in various fields. By challenging ableism and advocating for inclusion and accessibility, we can create a more inclusive society that values and respects the rights and abilities of all individuals. However, a detailed counterexample to this is the lack of accessible transportation options for individuals with disabilities. Despite laws and regulations mandating accessible public transportation, many cities still have limited or inconsistent options for people with disabilities, making it difficult for them to access public spaces. Additionally, discriminatory languages and attitude towards people with disabilities persist in various sectors, such as employment, where disabled individuals continue to face barriers and stereotyping that limit their opportunities for career growth and advancement. Biblical foundations on microaggressions on marginalized groups. When examining microaggressions and their impact on marginalized groups, it is important to consider the biblical foundations on these topics. The Bible calls for love, compassion, and justice for all individuals, regardless of their background or social standing. Some of these teachings, such as Matthew 7:12, Jesus teaches the golden rule, urging us to treat others as we would like to be treated, which includes being mindful of our words and actions to avoid causing harm. Galatians 3:28 emphasizes the equality of all individuals in Christ, emphasizing the need to challenge and dismantle any form of discrimination, including subtle and overt microaggressions, as we are all made in the image of Christ. Therefore, we should treat everyone with such dignity and respect. Proverbs 31, 8 through 9 encourages us to speak up for those who are oppressed and advocate for justice, highlighting the importance of using our voices and actions to make a positive difference in the world. Proverbs 31, 8 through 9 also calls for speaking up against these acts of injustice and advocating for these rights and well-beings of those who are affected. These teachings remind us that we have a responsibility to actively stand against injustice and support marginalized communities, just as Jesus did when he was on our earth and in human form. By following these principles, we can create a more inclusive and compassionate society where everyone is treated with dignity and respect. However, there are instances where individuals and groups may use their voices and actions to perpetuate injustice and discrimination. For example, some politicians or leaders may advocate for policies that target and oppress certain minority groups, leading to further marginalizations and inequalities. So all of these teachings that we see throughout the New Testament are grounded in to love everyone as you would love yourself and to do what is pleasing to God by treating all of his children as we would. We are all brothers and sisters in Christ and should treat each other as such. I just want to do a recap as well on some of the things that my partner had put in for our code of ethics. These code of ethics provide guidance and standards for counselors to ensure that we are practicing ethically, professionally, and responsibly. The ACA Code of Ethics emphasizes the importance of multicultural competence, social justice, and advocacy for our clients' well-being. On the other hand, the AACC Code of Ethics incorporates Christian values into counseling, promoting the integration of faith and spirituality in the therapeutic process. By incorporating these standards into our practice, we can actively work towards combating injustice and providing holistic care to marginalized communities of all different religious backgrounds.